So without further ado, I'm going to launch this event with a presentation on the main reason why we are here tonight, which is the 7th edition of our Plan to Impact report. If I can remind everybody, this year is a slightly different format. We've done a much smaller panel because we want to hear a lot more from you, your questions and your concerns around the Global Action Plan, the national plans, if they are working, if they're not working, how they're progressing, and any overall concern that you have. So please be kind and send us your questions, send us everything that you want to share with us in the question and answer. Please do use the chat box to introduce yourself and to say that you're just happy to be here, but use the Q&A so that the team at ADI can pick up your questions and I can have a chance to ask them to our wonderful panel. So about Plan to Impact, dementia at a crossroads. And so why did we call it dementia at a crossroads? Next slide, please. I have told you, I think, pretty much already about this slide, so we'll move on. We called it Dementia at Crossroads because this is the 7th year to the implementation of the Global Dementia Action Plan. So we only have 1 year to ask WHO to extend this, the plan for another period of time. And that is because we both believe that we've tried very hard to get the plan implemented, but it's being taken on. There is momentum, but it's very slow. And so we don't want to lose that momentum. We want to continue and reap the benefit of all the work of awareness raising that we've been doing the last few years. But before I get into the report, let me tell you something more about ADI. For those of you that may not know about us, we were established in 1984. We are the umbrella organization of 105 Alzheimer's and Dementia Associations around the world. We represent our members at the WHO, at the UN, at the OECD, at G7, and so on and so forth, in multilateral contexts. But we also do a lot of national and regional work, as you know. We are also the promoter of the World Alzheimer Report and of World Alzheimer's Month, which so many of you take part on. And our vision continues to be that prevention, care, and inclusion are needed today, as we hope that a cure will come tomorrow, but we don't just quite have a definite cure yet, although there is a lot of promising things on the horizon. Next slide, please. So before I move on, I want to remind you that we are doing the global survey for the World Alzheimer's Report in September. This is going to be a global survey on attitude to dementia. If you want to download it with that QR code and send it to everyone that you know, please, because this is a giant survey that will give us a really big view on whether the attitude to dementia have changed since we did the first survey in 2019. So please help us with that. Next slide, please. In order to download the report that I'm going to talk about now very briefly about, you can also download the report at that QR code. As you can see, the report is quite interesting because in the picture of the report, we have a lot of pictures of us showing the report from previous years to other people. It's very self-referential. But we hope that you will find it very interesting, more importantly. It is the only way we have to really chart year by year what progress is being made. And so it's becoming a very important historical document as well in order to chart progress, but also to chart lack of progress, and sometimes you're actually going backward. So it's a very, very important thing at our disposal. Next slide, please. So you will remember that every 3 seconds, someone in the world develops dementia. The total estimated annual worldwide cost is over $1.3 trillion, and that's rising to a lot more. And currently, we estimate there are 55 million people living with dementia in the world, and that will rise to 139 million, sadly, by 2050. And these figures have been growing larger and bigger since I've been at ADI, and more studies on prevalence and incidence have happened. We also know that a lot of those cases could be prevented by adopting better healthy lifestyle behavior, but we won't go there today. That is for another webinar. Next slide, please. Dementia is now the leading cause of death in 3 countries, in the UK, in Finland, and in the Netherlands. Is the leading cause of death, the second leading cause of death in 20 countries, in the top 5 in 38 countries, and in the top 10 in 72 countries. This is a very sad way of looking at it, but sadly, this is what's happening. And it's getting again more precise as more countries are starting to post numbers around this that they didn't used to before. Next slide, please. And this is the situation with the national dementia plans. Countries that have plans are countries in red. Countries that are developing plans are countries in gray. And Malaysia is one of those countries that is going to speak today because they're developing a plan that they are hoping to launch soon. And countries that have no plan, and as far as we know, no intention of developing a plan, are countries in gray. Now, you will note, I'm sure, sadly, that in Africa, we still do have a lot of countries lacking even the intention to start the plan, and we do need to do a lot more work in African countries. In South America, though, where we do have a lot of members of ADI, we are also still lacking plans, although it's a news of the recent few weeks that Brazil finally has a plan, which is a wonderful piece of news. We worked on it for many, many years. The wonderful organization FEBRAS, there's somebody here from Brazil that is saying yes, and rightly so, because this is an incredible piece of news and really great joy. It's particularly important that large countries like Brazil, like China also developed the plan in the last couple of years, are announcing this and hopefully drive also more enthusiasm and energy for dementia plans in their regions. Next slide, please. And this gives you a sense of the region. I was talking briefly about that. So as you can see, in the African region, 0 plans, regions of the Americas, 9 plans. This is divided by the WHO regional areas, European region 20, and so on and so forth. You can see for your region, where are we standing at. Next slide, please. And sadly, this gives you now, this slide we created when I joined ADI, and it gives you an idea of the progress towards the plan. So this slide tells you how many plans we have had since 2018. So as you can see, we are kind of standing still since 2022, but that doesn't mean that there haven't been new plans. It means also that in some countries that did have plan, like it happened to France, for example, we have gone back to not having a plan because either the plan has not been financed or the plan has been dismantled, or in many cases, plans are then subsided into different strategies. And this is not necessarily per se a bad thing, provided there is enough financing and specific focus on dementia, but in some cases there isn't, and it's a way for government to dilute their funding and financing of a plan. So this is something that for our members locally is very, very important, because ultimately we're here to make the life of people living with dementia better. And clearly, if people at the grassroots level don't feel the benefit of that, then that means that there is nothing. So we really cannot move forward. So next slide, please. And Tarun will speak more about that, but we thought it was important to put this slide up. This is not for want of a huge amount of work from WHO. WHO has done a lot here. So for each area of the Global Dementia Action Plan, there is an important product or activity that has come up that governments can take and can use. And this could be really quick wins. But in many, many cases, we still have issues with governments understanding how to use these tools. In some cases, our members have actually come forward and implemented translations, for example, or tried to get their government to implement a tool that they felt was very important. That is, for example, happened for a couple of areas like I support. On the right, we got ICOPE, which is the guidance on person-centered assessment and pathways in primary care, which again has been something that we've been working a lot more now with the Department of Aging at WHO to promote to more people. But I won't talk about that because we will have speakers speaking about these areas. Next slide, please. So what are the key recommendations of this report? Again, you can read the report for country by country information. So every country in the ADI network, we have 105 members plus 20 developing countries, have been giving us their view on what's happening on the plan. But our key implementation is the number of national dementia plan has stagnated since 2023, remaining at 39. This equates to 27% only of the 146 target. So this tells you why it is so utterly important that we implement the Global Dementia Action Plan, that we don't forget the Global Dementia Action Plan, that we continue and extend it for ideally another 10 years to allow countries to even understand what is happening, but also to take inspiration from other countries and continue to build on what is already been done. So we are calling for WHO member state to vote unanimously for a 10-year extension. And we have got a number of countries that have already pledged their support and told us that when the discussion comes, we will be doing that. And this is a great quote in particular from Kosuke Wada, which I think is following us online today, about why it is so important to have a plan. And Japan, of course, has been a leading light in leading plans for a long, long time. Next slide, please. So other key recommendations are the health system must adapt to the emergence of new treatment and diagnostic tools and ensure equitable access. Health system must shift at pace to be ready for new biomarkers and for new treatments. There's been a lot in our industry, a lot of discussion around this. The fact is that hopefully, cross fingers, we do have new therapies in development, and a lot of them are coming to the market now. So this is not going to be theoretical. This is going to be very practical. So people are going to ask for diagnosis and they're going to be asked for treatment. So so ignoring the fact that healthcare system have to be ready is not going to be an excuse. So something does need to be done. Care and support must be at the heart of national dementia policies and must not be neglected with the current focus on diagnostic. This is also a very important area. So we must not forget that if all the resources go to diagnostic and treatments, at the moment, sadly, we don't have a cure yet. So we are still going to end up with long-term care. So it's not a good idea to stop investing in long-term care because that's where we're going to end up in any case. So both sides of the equation are still very much present today. Next slide, please. And now I have finished the presentation of the report. I hope this has given you food for thought. And I hope that you can send us your questions online and the team at ADI will pick them up. And I am going to sit down. Wonderful. And start engaging with my wonderful panel. The panel will not present slides. They will talk to you about their own challenges, hope and opportunities for what we've been talking about. So I will start with talking with Dr. Fazidah and asking her to tell us what is that she thinks Malaysia is hoping to achieve in creating a new, brand new dementia action plan and why. Thank you.
Okay, thank you, Madam Chair. Okay, first of all, as mentioned by Madam Chair, I'm Dr. Fazidah Binti Yuswan. I'm not the Minister of Health of Malaysia. I'm actually here on behalf of my Minister of Health. I would like to convey his regards and sincere apologies to you all for unable to attend this event this evening due to an urgent matters that need his attention. But I will read his text before I proceed to answer what Madam Chair mentioned just now. Okay, let me read his text. It's more like political because it's prepared by our politician, but it's good because to achieve some to achieve some visions or mission, actually we need a commitment from our political, because this is what I learned what we learned, Ministry of Health learned from our team in our HIV STI sector when we fight HIV in the country. Okay, let me read his text. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good evening, distinguished guests, ladies and gentlemen. First of all, I would like to thank the organizer for the kind invitations for me to speak before our esteemed audience. The unanimous approval of WHO Global Action Plan on the Public Health Response to Dementia by the World Health Assembly in 2017 has imposed a commitment on all member states to take action on dementia. The global area are the best and most robust ways to manage the multifaceted challenges of dementia in the healthcare system, government, and society. As well as by the people directly impacted by the condition. An absence of public policy on dementia render many member states woefully unprepared for the growing public health concern that dementia present to society. However, in the progress report of World Health Assembly in 2003, the WHO Secretariat concluded that currently no target is on track to be made by 2025. And this analysis is mirrored by the Alzheimer Disease International On Progress Report from Plan to Impact 2023. That's what Madam Chair have shown just now. The observation is not target. The observation then that not target are currently on track to be made by 2025 is indeed disconcerting, underscoring the urgency for a collective and sustainable global effort to effectively address the challenges posed by dementia. The need for immediate action is evident, and the proposal for a 10-year extension to the global action is a commendable step toward ensuring a more comprehensive and inclusive approach. This extension aligns with the ongoing global shift toward universal health coverage and the shared commitment to deliver health for all by 2030. In this context, the extension provides a strategic opportunity to engage more countries in the collective pursuit of effective dementia management and care. Malaysia strongly supports the 10 years extension proposal. This endorsement reflects a shared understanding of the complexities involved in addressing dementia and the acknowledgement that additional time is essential for countries, especially those in need to develop and implement their national dementia plan effectively. The extent time frame will enable countries to formulate robust strategy, allocate the necessary resources, and foster collaboration with stakeholders at various levels. It also provides a realistic framework for achieving the objective set out in the WHO Global Action Plan. So now I would like to share with you some of the current status of our Alzheimer Action Plan that in Malaysia. As you know, we already developed a lot of IEC material like posters, booklet, pamphlet, and then we also conduct a lot of campaign talks to the public to raise awareness of the public and understand of the on dementia, to not only to the public but also to the healthcare worker. And we carried out all these activities with the collaborations with the NGOs and the private sectors. I think engagement with multi-sectoral sector play an important role to make sure the activities, whatever activities planned, in our setting will be more successful. And we also have a health screening at our 1,088 health clinic with aim to identify people with cognitive impairment for early diagnosis and appropriate intervention. And we also have, as of December 2023, we have 46 government hospitals which provide a geriatric care services and memory clinic in the hospital. And we already trained 66 geriatric physicians and 14 geriatric psychiatrists to provide these services in the hospital. But in the primary healthcare, we also train our healthcare workers, including the medical officer and the family medicine specialist in regards to the prevention and management of dementia. Okay. As mentioned earlier, Malaysia already developed our dementia action plan for 2023 and to 2030, which aim to ensure accessibility and sustainability care and support service in the country. And this is not only cater for the public, but also to people who live with dementia as well as their caregiver. With that, I thank you.
Can I please ask the audience to clap here? Thank you. I want this acknowledgement because I was in Malaysia in 2019, I think, and at the time, the word dementia really hadn't crossed the thought of the ministry. So this work has all happened since 2019. And I also want to acknowledge the work of a few people that have really worked very, very hard behind the scene to allow us to get here. So you know who you are. Thank you, thank you, thank you. And thank you to the Ministry of Health of Malaysia. Now I have an important video to show you. The person in the video is Emily Ong, who is one of our board members and a person living with dementia. Emily lives in Singapore, but is originally Malaysian. Emily, over to you.
Well, greetings to everyone and esteemed panel speakers. Welcome to this ADI site event. My name is Emily Ong, dementia advocate with lived experience from Singapore, and I am anak Malaysia. A current board member of Alzheimer Disease International, former board member of Dementia Alliance International, and a member of WHO Global Dementia Observatory Focus Group, WHO Global Patient Safety Network, and informal advisory group of WHO Symposium of Meaningful Engagement. I would like to give my acknowledgement to my senior advocate, Ms. Birgitta Matteo, who is unable to be in Geneva this year to give a speech due to a reason for, wishing her speedy recovery. As a person living with dementia, National Dementia Plan generates new hope for us and our family, because with the commitment from the government, it has the potential to change how dementia is experienced and understood by current and future generations. The plan remains the best tool any government has available to improve quality of life for those affected by dementia. With just 39 member state governments having so far developed national plan as indicated in the ADI progress report, the world still failing the dementia communities around the world. We are at a moment in time where the global number of people living with dementia will almost triple with rapidly aging population worldwide. The time to act is now. Governments around the world must develop and deploy national dementia plans. We are also entering a new era with new diagnostic and emerging new treatments, and people must be able to get access to a diagnosis and treatment as they become available. Equally important, people must be able to access care and support. They must be supported to live at home and in the community for as long as possible, to continue living a meaningful and purposeful life despite dementia. Care and support must remain at the forefront of national dementia plans, despite these new diagnoses and treatment breakthrough, which may take years to become available and accessible around the world. As we enter the final year of the current Global Action Plan on Dementia, it is absolutely crucial that governments call for an extension to the Global Action Plan. We must retain this vital tool of change to give people with dementia, informal carers, and their families the best support possible. As someone living with dementia, I can't emphasize enough how important it is to keep dementia as key national healthcare priority, to provide culturally appropriate information, accurate diagnosis and treatment, timely advice and support, and keep research going into all forms and stages of dementia. But do remember to involve people with lived experience to keep it people-centered. So I'm looking forward to our Malaysia National Plan, and do invite us at ADI to the launch, Datuk Sri Dr. Zulkifli, our Minister of Health. With this, do enjoy this event, and if there is one thing that I may request is to ask of your governments that they extend the Global Action Plan on Dementia. Terima kasih. Thank you.
Terima kasih to our wonderful representative of the Ministry of Health. I am delighted to be here today, but a lot of you, I hope that you can see us on video, will be wondering what I'm doing with my telephone. Well, the questions are coming in, and the only way for me to know that the questions are coming in is to look at my phone. So I'm not checking my Instagram feed, contrary to popular belief. Without further ado, I'm going to now ask Dr. Tarun Dua, who you all know and love, that has been one of the main drivers in the Department of Mental Health and Substance Use in the whole movement to try and get a plan there, and then to try and make something out of it. So Tarun, please tell us your thinking around WHO work in your area on that. Thank you.
Thank you. Thank you, Paola. Can you hear me? This is working. Yeah, it is. Yeah. So like Dr. Fazidah, I'm not Deborah Castell. I am Tarun Dua, and unfortunately, as you know, the World Health Assembly agenda has been delayed, and so she had to stay back. And coincidentally or intentionally, it has become an all-women panel. So, kudos for and the power to all the women in the world. So, yeah, no, I think as we think about the challenge that is due to dementia, and you have shown in the Plan to Impact report, there is a lot that countries, families, societies, health systems need to do to address the burden, looking at the numbers that are there, but also looking at the numbers that are going to be in the future. So not, I'm not talking about what's going in 2050, because that's beyond maybe my era, but I'm talking about 2030, when there would be almost like 80 million people living with dementia. So that's a huge number, and we have look at the cost, and and Global Dementia Action Plan, I think it was pioneering in terms of providing a framework about how countries can take action. And one of the things when we started to work in 2017 on the Global Dementia Action Plan, this was like, okay, dementia is a problem in high-income countries. And we know that 60% of the burden is in low and middle-income countries. So it's not only a problem of high-income countries, it's a problem, it's a global problem. And I think we need global solution to address this global challenge. The action plan was until 2025, and you read the action plan, it did say that we are setting ourselves with some ambitious targets. And I think as we have seen, with the progress made so far, we are not on the road to achieve any of those targets by 2025, and unfortunately, COVID did not help. While as part of the post-COVID condition, we have seen cognition issues, maybe more neurological conditions, but things a lot needs to be done. If we have to, even by 2030, when the countries will be discussing the next phase after the Sustainable Development Goals, whether what will be the real pragmatic targets that can be achieved by 2030, and so as we think about the way to look at, data is extremely important, and we are now in the phase, because we are by 2025, countries need to take a decision. What are they going to do with a global dementia action plan? And we heard from Malaysia that they feel that the action plan should be extended. That they need to look at, okay, where are we? And so we have started through our Global Dementia Observatory, to get the data from all the countries in the world. So since Malaysia is here, they have submitted their data. So congratulations, well done. But not all countries have. So those of you who are online, we have so far only data from 42 countries, and we need everybody else to submit their data. There are some that are in pipeline. So without naming and shaming, I think there's a lot that needs to be done, because that will provide information to member states. Okay, what do we do? Where are we with the targets? Having said that, extension of the Global Dementia Action Plan is not the answer. The answer is to take action and implementation that is needed. Now, one of the things, we heard about the need to have national plans, and I think that's very important. But we also know the fatigue that is in many of the countries to have a national plan on each and every area. And I think many of the countries are going for integrated plans. So and I think one of the important message, the first message that I would like to convey is that it doesn't matter whether you have a standalone plan or an integrated plan. What it requires is that there should be a plan on dementia, whether standalone or integrated. It should be funded and it should be implemented, as well as monitored. So that is true as we talk about the Global Dementia Action Plan, or we talk about any of the national plans. And that's message number one. The second message that I would like to convey is around supporting caregivers and families. And I think you would have realized that from the World Health Organization, this is an area that we are passionate about. We feel that is very important. Nothing for people with dementia and their families without them. And that's very important. And many of you are aware of our iSupport work that we do, the iSupport network that is being expanded and used in over 40 countries, available in 37 languages. But as I said, dementia is a problem everywhere. So we need it to be expanded to more countries. And my colleague Catherine is here, who leads the work on iSupport, and she can answer any questions that you have. The second point that is related to supporting caregivers is thinking about the care and treatment that Paola mentioned, but also I think the related issue that I would like to bring in here is about the research that is happening for dementia research. So a couple of things related to dementia research. So as at WHO, dementia for us, this is a critical area. And why I say so, that if you look at all the non-infectious diseases, forget about Ebola, COVID, or where there has been a blueprint, we have amongst all of these NCDs, mental health, the only condition where there is a research blueprint is dementia. And, I'm quoting here Peter Pio, who says that it's a ticking time bomb. And that's the reason we said we need to have a research blueprint. And Rodrigo is here, who has been leading the work. And I think the important thing about Dementia Research Blueprint is that it is about coordinating the efforts and ensuring that the findings of the research are translated into policy to the low and middle income countries. I think and that's why WHO has developed this research blueprint. There is, in terms of the treatments and diagnostics, in fact, we are working on a preferred product characteristics for blood-based biomarkers, which will be released in the World Alzheimer Month. So watch out our space to have this, which I think will help in ensuring. And the idea that we are doing this PPC is that we want that these blood-based biomarkers are available for the low and middle income countries. And I think that's why we are investing in research. We are not doing studies. What we want is that the research is coordinated. It's not fragmented. It involves people living with dementia, their families, and it is bottom up, I think, and it is in low and middle income countries where the burden lies. Third point that I would like to make is about prevention, risk reduction of dementia. And I think we know a lot about the various risk factors that are associated with dementia. But as policymakers, countries ask, okay, what can we do about it? Which interventions will work? How much of, so it's not only about understanding the association of, okay, there is this risk factor associated, like hearing loss, but what can we do about it to prevent dementia, to reduce the risk of dementia? So I think you would be all pleased to know that we are updating our dementia risk reduction guidelines. The process is just starting, and we will there is a lot of new evidence that has come since our guidelines were launched in 2019, and I would like to thank Canada for the support they are providing for this, and we anticipate publishing these guidelines in 2025. And I think these were my three main messages, but I would like to conclude by saying that if we have to address this challenge that we see due to dementia, the important thing is collaboration, the important thing is partnership, and the important thing is working together, be it at national level, be it at regional level, be it at global level. And we thank ADI for being a wonderful partner to WHO in taking forward and working with us, in ensuring that we are able to provide care, to services for people across all the countries. So thank you, Paola. Thank you, ADI team.
Thank you very much, Tarun. For also going into quite some level of details of really, really important issues. I mean, there is a real disconnect, as Tarun was saying, between the fantastic amount of research that is coming out and how many people really adopt it. And time and again, we go in great examples of care homes, for example, with a lot of research policy, research on care is adopted, and a lot where it isn't. And it would be so much easier to adopt better care for everybody. So this is why also a plan is so important, no? Because it allows people to reflect. Like in the case of Malaysia, what are we doing as a country? Are we doing enough? Are we adopting the right forms of work? Now, as we are waiting for Anshu to join us, but in a few minutes, I'll probably ask Matteo to come up. I've got a number of questions, actually, and some of them are really interesting. So what I will start with, given that Tarun was the last speaker to speak, is a question for you, which is what happens if the Global Action Plan is not extended? This is from the online audience. I have another question from the online audience, but if anybody's got a question, please raise your hands in the meantime, so I know, and I will call on you as well. So Tarun, yours is the first one.
So I think action plan, they are governing body mandate, and all countries, they sign up to the action plan and they define the work that needs to be done. Now, We are optimistic that countries would, as they would discuss it next year with the report that will be submitted to the countries, that countries are very much behind achieving their targets. I'm sure they would also understand that a lot that needs to be done, looking at the numbers, looking at the economic cost, and looking at the burdens. And they would realize the importance of the strategic action areas that the action plan has come out with, having dementia plans, having investment in risk reduction, dementia awareness, dementia friendliness, investment in care. So it's, as I said, it is about having a plan is one thing. The most important thing is action. And this is where all countries need to invest. Dementia is not going anywhere. It's not something that is a disease that can be eliminated, eradicated. This is a reality. And if countries are not going to invest in improving services, improving care, this is going to lead to huge economic challenge in coming years.
Thank you very much, Tarun. There is another question that actually has been asked by a lot of people online, including Kozuke Vada, who is one of the big advocates of this. And this one is really probably for the Ministry of Malaysia. And you can also draw on your wider experience of that. And it's so critical to the success of National Dementia Plan to involve the people who live with dementia, like Emily, and carers in the discussion with the ministry. So how are you planning to involve people in that have lived the experience of the disease?
When we developed this dementia action plan, actually we already involved the NGO, that is the civil society, and also those people who the caregiver for the people who live with dementia. We already working together in developing the dementia plan of action. So that's why it's become clear how are we going to use the plan of action to implement what we already draft in the planning.
Thank you very much. Then maybe perhaps I can encourage you to use more people living with dementia themselves, like Emily, and I'm sure she knows quite a few people that could be involved in that process. Now, I would like to call on Sultana Afdal first, the CEO of the Wish Foundation in Qatar. Sultana raised her hand for a question, but also Sultana is the promoter of a very important report that we co-authored together with Maha, who is with her on palliative care, and Stephen, that was one of the authors as well, who is here from the World Palliative Care Foundation. So, Sultana, what's your question?
Hello. So my question was to the Ministry of Malaysia, because when we started thinking about dementia, and actually, Qatar was part of the Global Dementia Observatory some time ago, one of the first countries in the GCC that adopted it. One of the problems we had with diagnosis of dementia was the stigmatism around it. And if you come from a country that's predominantly Muslim, you will know that parents are something to be quite revered and respected, and to put a label like that was very stigmatizing. So I was just wondering, how did you get around that? Because what we tried to do with the messaging was, we did a report in 2018 on Islamic ethics and palliative care, but we also looked at dementia as your parents have the right to access care, and by not, allowing them to be diagnosed, you're actually denying them that care. And so there was a lot of messaging around it that had to kind of, emphasize the need for care rather than the stigmatization that you apply to somebody. And even the word in Arabic is actually quite a stigmatizing word. So we also used to say Alzheimer's rather than the word that we typically use.
One for you.
Okay, now, despite that Malaysia have developed this action plan, we still face a lot of challenges in regards to this. One of it, as mentioned just by our audience, is related to the stigma. We do realize we're still facing persistent stigma in regards to dementia. But what we believe with correct information, about dementia and raise awareness consistently to the publics and to the caregiver can play a role to reduce the stigma related to dementia. Okay.
Yeah, it's going to be a challenge. And of course, Qatar has a lot of really positive examples. So we always encourage governments to also look at countries in similar cultures that may have dealt with this issue. I mean, Indonesia also, although of course that's also an example very, very close of a country that has moved in that direction. Thank you, Sultana. Now, can I ask Matteo to join us on the panel? And whilst Matteo settles himself, can I ask Rosa San Giorgio, who is with the Women Brain Project, now the foundation, to ask her question? Thank you, Rosa.
So the first question was to Paola and to the panel. We saw that in terms of number of countries adopting a plan, we are below the 30%. But you didn't mention anything regarding the quality of those plans. So can you tell us how appropriate and if there are some plans that could be considered as best practices? And the second question is, and sorry, Matteo, but as I saw a only women panel that you joined, and as Paola mentioned, I'm representing the Women's Brain Foundation. The question that I have is that we all know that obviously all mental diseases affect women differently, in particular Alzheimer dementia. So is there anything, or are you seeing anything happening in the direction of more precision medicine, looking at sex and gender?
So in order to give Matteo a chance also to do his piece, I'll try and respond to the first one quite briefly, and I'll pass the second one to Tarun so that she can compose her thoughts on that. So on the plans, yes, there are some plans that are a real shining example of covering all ground. Famously, the South Korea one is excellent. The Japan one obviously is great. These plans have gone through several iterations. That's the other thing. They create a plan and then they refine it, and then they think about it, they evaluate it, they bring new things. Whenever I read those plans, because we actually do read the plans, you always are amazed by the amount of insights. And when we go to countries, we always tell people, look, these people have dealt with this in this way, you may want to have a look at it, because again, there's no point in reinventing the wheel. Some people have already done it and done it very successfully. So yes, there are some plans that are better than others. A lot of that information will be in the report for those of you that are courageous enough to read it. So Tarun, yours next one.
Thank you, Paola. But also building up on what in terms of the best or good practices. As part of our Global Dementia Observatory, there are two sources of information that would be relevant for you and other audience. So one is that we have, when we ask data from the countries, it's not only we ask whether they have a plan, it's a standalone plan, it is an integrated, we ask for other information in, to assess the, in terms of its funding, in terms of its involvement of people with lived experience, its implementation, then there is a lot of detail that is available. So that's a good source in terms of getting information on dementia plans. Then secondly, we also on the Global Dementia Observatory have best practices in terms of services, care models, risk reduction, etc. So that's, I would encourage you to look at that source. Coming on to women and Alzheimer and dementia, we know that the numbers, but that women are impacted more, but also there are caregivers, that 70% of caregivers are actually women. So something that's within our I support, we are looking at it very, very carefully. And also in our risk reduction guidelines, we are actually looking at the biological issues that are related to menopause, hormonal therapy, etc. So these are very pertinent questions, and that we need to address.
Thank you very much, Tarun. Great question, and we should do a little bit more in this area as well. We will talk about it at some other point. Now, I would like to thank briefly Dr. Matteo Cesari, who very bravely occupied the seat for about 1 minute. Thank you, Matteo, which is the acting unit head on aging and health. And I'd like to welcome, and I hope, Anshu, you have been able to take a breath, Dr. Anshu Banerjee, who is the director of the department, I've got to read this because it's very long, of maternal, newborn, child, and adolescent, and critically aging at the WHO. Anshu, welcome. Thank you for being with us. Anshu was held into another meeting where he was asked to go at the last minute. Thank you for being with us. You've got now, I think about probably 5 minutes, maybe we got half a second for a question. So there you go, 6 minutes. Yes. Have you taken a breath? I'm trying to take a breath. Welcome. So please, your comments on what is happening at the WHO in your area around the Dementia Action Plan.
Okay, so I wanted to highlight particularly the work that we're doing as a department around the UN Decade for Healthy Aging. And of course, we see a lot of parallels there between what's happening in the area of dementia and what's happening in the area of aging. First of all, if you just look at projections for the number of older people, it's going to increase tremendously by 2050. And it's not only an issue in high-income countries, it's actually also becoming an issue, or I don't want to say becoming an issue, but the number of older people in low-income countries and middle-income countries are also increasing. And we can see that from the requests for technical support from many African countries who want to have a feeling of, you know, what do we do? How can we support older people in our communities, etc. So secondly, and we'll have the same with dementia, of course, because the burden of dementia will increase as populations are aging. So I think we are, let's say, walking together this pathway of the epidemic transition, let's say, of having an older population and at the same time having a higher burden due to dementia. At the same time, when we look at our areas of work, long-term care is one of the areas that we are definitely investing in and looking at. We came out a few weeks ago with what the UHC interventions are for long-term care. And I think similarly, when we look at what's happening in dementia, it's important that we take a life course approach, just as we do for healthy aging, and that we look at how we can prevent promote healthy aging and prevent dementia. And there are a lot of parallels there because most of the risk factors are actually similar. We want people to be physically active. We want them to be engaged in community and have social connectedness. We want people to eat healthy. We want people to sleep well. So all the kind of, let's say, addressing the NCD risk factors, Katie, all those risk factors are sort of, you know, across the life course. And we should make sure that people at a younger age actually already are aware of those, because it will have tremendous impact later in life from a healthy aging perspective, but also from a dementia prevention perspective. So I think, again, there a lot of alignment in sort of the work that we're looking at. And then when it comes to taking care, I think it's very important that we align ourselves, because even though, you know, we can have younger people who have Alzheimer or early onset of dementia, on average, let's say it would be more the older population. And when we look at aging in place, we should look at, you know, how can we support people at home, in the community, and if needed, if they're really dependent on care that cannot be provided at home or in the community anymore, how do we do that in a facility, whether it's a home or a long-term care facility? So I think a lot of parallels there. I wanted to make one proposal. And as we are walking the decade jointly with our mental health colleagues in looking at how we can support ministries of health to look at healthy aging and support the dementia agenda together, I hope that when the decade of healthy aging has ended in 2030, we'll have a decade for mental health and well-being. And particularly because we can then keep on walking jointly for another 10 years.
Yeah, I like that. Yeah, sure.
And particularly because, you know, the COVID pandemic, which is this decade, has really shown us how important mental health and well-being is. or mental health is for the well-being of the population, whether it's for younger people, older people, the connectedness, the intergenerational engagement, very important for healthy aging, that people still engage with younger people and teach them, and at the same time support them, take care of them. So from a caregiving perspective also, I think, very important that older people still feel that they can contribute to society, but that they themselves are also taken care of when needed. And I think, when we look at the dementia agenda, it's very similar as well. So yes, this was my take-home message for today, that we are on this together as part of the decade of healthy aging. And I hope that maybe we can initiate a decade for mental health and well-being from 2031 to 2040, because well-being is something that we need to move forward jointly. And I think it's the big agenda item post SDGs.
Much, Anshu. That's an important message. Now, for the hundreds of you at home, hello, we haven't forgotten you, who have no idea what we talk about when we talk about a walk. At the WHO, in the days before the assembly, there is a big walk that happens, and this is also to promote well-being. Many of you organize Walk for Dementia in your own home during World Alzheimer's Month, and we thank you for that. And it's really interesting that you can now hear it from the people that promoted this. The Decade of Healthy Aging has been a very important mechanism to bring to the attention of governments risk reduction behaviors. And I think this is so critical that we continue and have to continue to promote mental health well-being. We know from all of our reports how important that is, because so many carers and people living with dementia, in particular after diagnosis, because of lack of post-diagnostic support, still experience terrible times in mental health that really should not be there, because support should be provided. So let's remember that we are not just talking about silos here. Everything is connected, and we are trying to make sure that those connections remain, although individually we all have to address things one by one. I can see there is one question from the audience, so definitely yes. I hope it's for Anshu, so he's got his question. We've been answering a lot of questions before you arrive. So please, tell us who you are as well.
I'll have mine, of the One Goal Initiative for Governance. I'm based in Geneva. And I wanted to refer to something that you said in your presentation, and I was so happy you said it. It's important to have the treatment, or to invest in the research for obtaining better treatments, more, I would say more than research and solutions for diagnosis. And it's very important, because if we don't have as much, I guess, or as good a treatment as we have diagnosis, what this leads to is necessarily some kind of triage, right? So that is why it's important.
That's a very good question. Thank you. Let me clarify that. So we believe that everything is important. So, making dementia public health policy, risk reduction, dementia friendliness, diagnosis, treatment is all important. Our concern right now is that we have seen a number of governments getting very excited about the possibility of having treatments. First of all, these treatments clearly right now, some are available already, but not to everybody. So there is an issue of equality. So some countries don't have treatments. People that are wealthy can travel to countries that do have treatments. So there is an issue of equality there. The other is that we are concerned, a lot of countries, their healthcare system is not prepared for even enacting diagnosis, let alone having the treatments. So when people will start realizing that there are possible treatments, they will ask for diagnostics. Now, in the diagnostic area, a lot is happening, but let's look at the diagnostics we have now. There isn't enough capacity to allow everybody that will ask to have diagnosis. Then worse, after diagnosis happen, a lot of people are left without a clear post-diagnostic pathway. So what do you do once you've been diagnosed? That's in primary care setting, a lot of people don't know that. And finally, my concern, the one I was referring to, is that we also need a lot about care research, which is not coming out. So care research is not being applied. So we know a lot about better care, but actually we cannot see the application. So everything is important. Research, treatment, support, diagnostics. It sadly, and as Tarun was saying, dementia is complicated. It's a very complex disease. That's why we have a global dementia action plan. And that's why unless we move all of these fronts together globally, we are going to end up with some big problems here, exacerbated by the aging populations, exacerbated by the fact in 2030 there's going to be 80 million people and not 50. And that, what are we going to do then? So this is what we are trying to bring to the attention of governments. It's great that governments like Malaysia are taking this on and doing something now, because if you start doing something now, you are going to be much better prepared. Thank you. And Anshu, please.
No, I would like to just highlight something. I think treatment will evolve, and that's why also why diagnosis and maybe earlier identification and identifying certain biomarkers is going to be important to predict what will happen, because the treatment that we will develop now is most likely for late stage. And as we are able to diagnose or even predict earlier on in the life course, the management might be very different. And so then the research in developing the interventions that would have to be done earlier in order to prevent maybe or reduce or slow down the progress of the disease is going to be important. So, I mean, I'm just thinking of, let's say, breast cancer or something. In the past, you would have to do a full mastectomy. Now you can pinpoint much better, you know, is it localized? You have detected it much earlier, etc. So you can still save the breast. It's a very different kind of intervention because you identified much earlier on. I think for dementia, it would be similar, that we need to be able to identify, diagnose earlier, potentially. Working, I thought. Diagnose it earlier, potentially be able to predict it earlier in the life course, and then be able to intervene much earlier so that you can prevent the progression towards dementia or the pace of progression to dementia.
Thank you very much. In the meantime, through my magical telephone that I've told you earlier, it wasn't being used to check my Instagram account. I've been given my orders. So unfortunately, we'll have to wrap up the event now. But there's been a lot of things that have been raised here. Once again, I encourage those of you who haven't yet to look at World Alzheimer's reports past. The World Alzheimer report 2021 is on diagnosis. The one in 2022 is on post-diagnostic support. The one this year was on risk reduction and prevention. So a lot more that we can do here. We'll do it together though, as ever. Thank you for those of you that have stayed up very late at night. We've had a lot of messages. Thank you to the many of you that have attended. There's a lot of lovely familiar faces here. Thank you for coming. Thank you for continuing to follow what we do. And hopefully see you soon again at another ADI event, probably online. Thank you.